Well, good morning, everyone. I'm Gary VanLandingham with the Pew Charitable Trust, and welcome you to this morning workshop on evidence-based policymaking. We're excited to be able to bring you several perspectives on what evidence-based policymaking look like in states and some opportunities to come to your state and to provide some help for what we think are some of the toughest challenges that are before you. And as you well know, you have been in challenging times for the last few years. If you look across the country with the Great Recession, states were put in the most difficult situation they'd been in since the Great Depression. And you well know that the tough choices that you had to make. Collectively, if you look across the country, states had to cut somewhere around $500 billion. That's $500 billion out of state budgets. That is an unimaginably huge challenge for states, considering that many states have budgets around $5 billion. So if you think collectively, add all that up, you recognize that the scope of the tough challenges states had. My home state in Florida ended up being somewhere around 23% down on general funds at the bottom of the recession. Florida was one of the first states in the recession and was one of the last states out of the recession. Florida tends to do that. The state motto is selling overpriced real estate to people from up north. And that tends to be a cyclical thing. So Florida had, I think, 8 rounds of across-the-board cuts. And you can sort of understand what that did to agencies and programs. And that was not a happy time for Florida, and I imagine it was not a happy time for states. With the possible exception of our friends in North Dakota, everybody was facing some really tough times, and the folks in North Dakota will say that times have also been challenging there simply because of the challenges of the growth that has been happening in the state. The good news is there are now tools coming available which can really help states deal with these challenges, which these tools have not been available before. And we think that this is really an exciting time for states because while the challenges that are facing states are going to continue to be fairly significant, I don't think any state feels that we're going to get back to those wonderful days of 7 to 10% revenue growth that we had in the 90s. But there are some opportunities out there to really fundamentally change how states do business and to get better outcomes at a more reasonable cost. We want to talk about 3 of these sort of toolbox sets today. The first is results first, which is a way to really use business discipline to help inform policy choices in a way that simply hasn't really been possible in the past. To really take a look at how states are spending money, what are the real opportunities out there, what things would really help us get more bang for the buck, recognizing that the bucks that we have are going to continue to be short. But there are really better ways of channeling money towards things which are proven to work better than some of the things that states are doing now. Second, we're going to talk about looking at tax expenditures, which is something that all states spend a lot of money on. Collectively across the country, states spend billions of dollars every year on a variety of tax expenditures, largely designed to improve economic competitiveness and to create incentives for business to come into states and do good things. The question is, are we really getting the bang for the buck for those incentives? Is there a good way to look at those incentives and say, is this the way we want to be doing business? Are we getting enough out of those incentives to justify the cost of foregoing revenue and to help make better choices on how we can put good incentives in place to create the good business climate that we want to have, but do so in a fiscally responsible manner? Third, we want to talk about the health impact assessment process. We all recognize health is a huge issue across the country. States spend now almost about a quarter of their budgets on Medicaid. Health challenges are everywhere in society, and we're increasingly recognizing that health issues are very interconnected with a lot of things that states do. And we want to talk about a process of really bringing some of that thinking into the process that help us think through, if we take this choice, what are the implications across the healthcare budget? Because there's times when a choice which doesn't seem to have implications for public health does have implications for public health. And we're going to talk about a process for really building that type of thinking into the decision-making process to give you a broader perspective of what would happen if we do different policy choices. So we're going to have really 3 different perspectives on evidence-based policymaking today, but the fundamental thing that we want to sort of bring it to you as a takeaway is we can do a better job of thinking through policy choices now than we've ever been able to do in the past. And by doing this, we feel that there are really some real opportunities for states to change the way that we do business, to produce better outcomes for citizens, and to do so in a more fiscally responsible manner than we've ever done in the past. So we're going to start talking about the Results First Initiative. The Results First Initiative has been around since about 2011 when we started bringing this approach to states. And this built on work that Washington State's been doing for years. Washington State has created a really fundamentally different and more powerful way of assessing policy choices. And we want to sort of dive into what this looks like in the states, give you an idea what this approach does, and then talk about what we're seeing with some of the states that we are currently partnering with. And you understand what the policy choices are. I mean, we spend a lot of money trying to deal with really tough public choices out there. And that is the governance challenge. There are tough problems out there. How do we create a situation where we build a criminal justice system that keeps our citizens safe but does so in a fiscally responsible manner? How do we build an educational system that produces the outcomes we want to have, which are kids who are good citizens, who are also economically self-sufficient, who basically can fit into the workforce system and create the national economy that we want to have? And unfortunately, frequently we sort of feel at the end of the day we're spending a lot of money, but we're not really getting where we want to be. We spend a quarter of our budgets on Medicaid, but if you look at the national, international statistics, we have huge health challenges. A lot of our population is not particularly healthy. We spend a lot of money on education, but somewhere in the neighborhood of 25% of our kids drop out of school before they graduate. And the kids who do graduate, frequently when they go to college, have to take a lot of remediation classes, even though they just graduated, because they're not college ready. And if you look across a lot of policy areas, we're simply not getting the results that we want to have, even though we're spending a lot of money. And so this is where a lot of the political conversation takes place. Is the problem that politics, that we know what we should be doing, but just because of the political disagreements, we can't really come to agreement, so we're not making good choices? Well, seeing as I'm now living in D.C., I can probably tell you that politics is a challenge at the federal level because our friends in Washington really aren't getting a lot done these days. But in states, actually, the cool thing about states is states have to make decisions. States have to actually pass an annual budget. States have to actually make policy choices. So while politics it's always an issue, I don't think that we can say that the challenging outcomes that we're seeing are the results of politics. Well, is it that nothing really works, that we're spending a lot of money on things and none of this stuff works, so what we really need to do is just kill everything and, hey, we're just wasting all of our money? And there's some truth to the fact that we are funding things that don't work very well, but there are things out there that does work. Or is the challenge that we're simply not spending enough? We have tough choices. What we need to do is double down and spend twice as much on health care, twice as much on education, twice as much on child welfare. And if we do that, then we'll get the outcomes we want to have. Well, there's some challenges in that. One is I don't really see that anybody thinking that the citizens are suddenly going to double the amount of money that they're giving states. And what we're seeing is that there's not a lot of correlation between how much we spend on a lot of issues and what the outcomes are, because we can spend a lot of money on things that don't work very well. And that is one of the challenges that we're seeing. So I think that what we're looking for is a way that gets us out of this argument of nothing works versus everything works, and so we just need to try something because this is a tough challenge, and start really focusing on what we know about what does work and focus the attention on that. And the challenge is it's tough to do that in the policy process, and we understand that. The budget process is designed to be incremental, and that is the way that states typically make decisions. There's a lot of inertia in the system. Next year's budget will look a lot like this year's budget, and it looks a lot like last year's budget. And when times get tough, the things that we tend to do is we cut across the board. And there's some reasons for that I want to talk about. But the process, there's a lot of inertia built in the process. And there's not a lot of evidence based in the process. A lot of programs are defended by advocates based on anecdotes rather than data. And you guys know this very well. Whenever a someone comes to you during session and says, I've got a great idea. This is a program, it's been a pilot, we need to go statewide. What they will give you is what I call Little Timmy stories, which is the story, the heartwarming story of this person who went into this program and wonderful things happened to you. And Little Timmy stories are wonderful, they're heartwarming. The question is Little Timmy the only person out of the 5,000 who were served by that program who really has that outcome? Or is it really the case that Little Timmy is everybody who's served by this program? But at some point we need to get past inertia and anecdote and focus on things that actually result in better outcomes. We need to get past the situation where we are making choices incrementally, that when times get tough, we cut everything across the board because we're 5% short. The challenge of doing that is that if we have a really effective program, we're hamstringing it because that's 5% of good outcomes we're not having. If there's a bad program out there, a 5% cut isn't what we want to do. We probably should target those cuts much more than we do. The challenge, of course, is that while everybody wants to do that, the question is, what are those good programs out there? What are those bad programs out there? States haven't had a good way of really identifying what is the best program choices out there and what things simply don't work very well. We do a lot of things to try to get agencies to identify those things. States almost always will say, tell agencies, prioritize their programs. If you had to cut 5%, what would you cut? If we gave you 2% more, what would you put more money in there? And universally, nobody's really happy with what agencies come up with because agencies will frequently give you a list of things that they know are very difficult to cut. So, if you cut us 5%, then, 5,000 people will starve to death. In D.C., if we have to cut any money out of the budget, we will close the Washington Monument and we'll close the White House tours. So you don't really have a lot of confidence that those exercises are really giving you the information you need to make strategic choices. And so we need to get past the situation where we have a huge information lack. And from a business perspective, there's a lot of things that we don't know about the business of government that we should have. Think about the enterprise of a state. My home state of Florida has around a $70 billion budget. And say that you are thinking about how to invest some of your money and someone comes to you and says, I've got a great investment opportunity for you. It's a $70 billion corporation. It's on the Fortune 500. And you say, tell us what you do. And the CEO says, well, we do a lot of stuff. We provide healthcare services. We provide transportation services. We provide child welfare services, we run pre-K services, you name it, we do it. I said, well, that's kind of a very diversified enterprise. Can you give me a list of all the services that you provide? I want to see what your products are. And basically they'd say, I don't really know that. I can't tell you all the things that we do. That's not the mark of a good company. But I can pretty much guarantee you that virtually nobody in a state government has a comprehensive list of everything the state does. Florida, my home state, I know does not have such a list. There is no comprehensive list of everything the state of Florida does. The legislature has tried multiple times to create a list to determine what is in the appropriations base. The governor's office doesn't have a comprehensive list of everything that the state does. And when we've done things like program budgeting, where we've asked agencies, okay, we're going to budget you by program, and we'll give you budget flexibility, but we want results by program, what they do is they come forward with amazingly few programs. Department of Education in Florida argued that there was one program, educating kids. So that's the lump sum that they wanted for K-12 education. Department of Agriculture, which by my count had 78 individual programs, things like inspecting gas pumps, inspecting weights and measures, feed, seed, fertilizer inspection, argued they only had 4 programs. Protecting consumers, encouraging agriculture. So it's very difficult to sort of get a handle on what states do, but we need to do a better job of that. So states don't really know what they do in terms of all the programs, all the activities that are being done out there. We also typically don't know how much those programs cost. We organize state budgets by organizational unit, almost always, or sometimes by broad programs. So in Florida, the Department of Agriculture gets a budget and they break that down by division and sometimes by bureau. But the budget doesn't track money by activity. So we don't know how much it costs to serve people in different programs. We have some ideas. We know how much it costs, for because of the educational funding formula, we know how much on a per child basis we give per child, but we can't really break that down by how much we're spending on reading for a child, how much we're spending on mathematics education for a child. We don't know things like fairly basic things. How much are we spending on health care for people with different types of diagnosis? So again, you're investing in a business and the company says, I can't really tell you what my services are. I can't tell you how much it costs to produce these services. I can't really tell you whether people like my services or not because we don't have good outcome data on this information. And I don't have any way of comparing services to say what's really getting me the more bang for the buck. This probably is not a company that you really want to invest in. But this is the way that we've tended to run government. And we run this government this way for a lot of reasons. It's an ongoing concern. We don't want to fight political battles over everything that we can. There's a ton of stuff in the base. Nobody has time to go into all those issues, particularly during the legislative session. But at some point, we need to come up with a way where we can really look at how we're spending our money and determine whether we're getting the bang for the buck that we could be doing, or whether there's other choices out there that allow us to do this type of analysis. And the good news is there is an approach now which allows states to do this in a much more comprehensive way than we've ever been able to do in the past. And this is what Results First is about. It's about identifying how we're spending our money, what are the other options for spending the money, and giving us a way of doing an apples-to-apples comparison to say, is this the best policy choice? Or is there something else that we can be doing that helps meet this goal but does so in a more effective way without spending more money? And the solution here is what we call Moneyball in government. And it's all about bringing more evidence into the process so that we can use this evidence to help inform choices. And I think probably most folks are aware of the story of Moneyball. It was a book that came out about 2000, a Brad Pitt movie last year. And it's the story of the Oakland A's, which is a fairly small market team out in California. And they found themselves having to compete with the Yankees and other big market teams, even though they had 25% of the money that the Yankees had. So the choice is they could either lose most of their games because they're going to be outspent for all of the big name players, or they could find a different way of spending their money to basically buy the outcomes that they wanted to have. So they basically came up with a way of using statistics, using data to help drive their choices of what players to play and what players to put on their team. And they did that in a comprehensive way, and it worked. Simply by using information to guide their choices on what team to field every day, they were able to field a team that was just as successful as the Yankees, even though the Yankees were spending 4 times as much money. And that really was a revolutionary approach to baseball. We think that we can do this revolutionary approach to policymaking now by basically using data to help identify what team that we can field, and in government, the team that we field are the programs that we put in place. How can we can use data to help identify what team we can put in place to achieve the goals we want to have, using rigorous evidence to target policy choices. And the good news situation is, even though every state is somewhat different, and no state has the data to go out and rigorously evaluate every program that you're operating. Nobody has the money and the bandwidth to do that. Well, the good news is that over the last 40 years, collectively as a country, we have done that in a lot of policy areas. Tens of thousands of high-quality evaluations have been done across the country. Now, the challenge is, how do you get your arms around that? Because if you talk to staff and say, I've got an idea, I want to do something to reduce recidivism in my state because I know we're spending a lot of money on people who come into prison and we let them out and 6 months later they're back in prison. We spend a fortune on that. I want to fix that problem. Tell me what I can do. You probably don't want to hear, great idea, give me about 2 years and I'll go through all that research and give you a comprehensive list of all the research findings that have been done to really help inform the tough choice that you want to make of how to invest in recidivism reduction programs. Because who has 2 years to do that work, particularly in the real time of a legislative session? Well, the good news is there are a number of organizations that are doing that. They're going through this rigorous research base and identifying collectively what we know as a country about what works. And we know about what works now in a lot of areas. And we can use this evidence to target funding in a way we haven't been able to do before. This allows us to do some good things. The cool thing is this allows us to do some things as well, such as stop funding things that don't work. And there are programs out there which sound great but don't work. And there's been some great research that's been done on ideas. And what that research finds is that frequently about 70% of the good ideas, when rigorously tested, are found not to work. The key is to rigorously test them, because if all we rely on are those little Timmy stories, everybody will give you a little Timmy story. They will. So consequently, that's not real data. You'll never find ineffective programs by listening to only what the advocates say during legislative sessions or what they say when they come into your offices, because everybody's got a little Timmy story. But by using rigorous evidence, the collective knowledge of what we know about what works, we can identify those programs out there that simply don't work very well. The other key part of this is we need to pay more attention to how well programs are implemented. A really good program that has been proven to operate effectively in a state will fail miserably in another state if it's not implemented well. And this is frequently a huge challenge in government. We don't spend anywhere near enough time or emphasis on how well agencies are implementing programs. And what we find is a program which is a good program has miserable results if we don't pay attention to it. Washington State learned this the hard way. Even though they are pioneer in evidence-based policymaking, they were investing heavily in a program they'll talk about in a little bit, functional family therapy. And after a couple of years, they asked the question, are we getting what we're paying for? This program was predicted to have this impact on crime. Are we getting there? So they went out and did an evaluation and found that in about half of the state, they were getting about exactly the predicted outcomes. In the other half of the state, they were not getting anywhere near the predicted outcomes. In fact, some cases, they were making the kids worse by putting them through this program rather than better. And they found that happened because the agencies were not implementing those programs correctly. They were hiring people who didn't know what they were doing. They were not monitoring the therapy that the kids were being provided. And in some cases, they were making this problem worse rather than better. And the state learned that you have to pay attention to how we implement these programs. That's a huge challenge out there. We have to do a better job of that. Most of us flew here to get to this meeting. And personally, I flew on Delta because I had reasonable confidence that it was a good plane, that the pilot knew what they were doing, and that the plane was maintained. And unfortunately, in government, we frequently say, it's a plane, how hard can it be? Okay, it looks like a plane, it's got wings, okay, must be a good plane. And times are tough. I think we need to cut back on this training stuff. So we need to, it's a pilot, he says he knows how to fly. I saw him take off and land, we're cool. And I don't want to pay attention, I have to cut maintenance, I have to cut something, and I'll know if there's a problem if it shows up in the media. That probably isn't the way that we would want our airlines to fly, but we too often operate government that way. We need to start paying more attention and building that attention to how programs are implemented into the process. If we don't, we're simply wasting money. And the good news is by doing this and using a disciplined approach to how we do the business of government, we can achieve dramatic improvements in outcomes without spending more money, simply by fielding a better team and making sure that they're well coached. If we do this, we can get to where we want to be, and we'll talk about sort of what this looks like in the process. So the Moneyball approach, I think, is something which is getting a lot of attention nationally and internationally. It is an approach which requires changing how government thinks about programs, but the nice thing is by using evidence throughout the process, we can get the outcomes we want to have and to do so in a very fiscally responsible manner. So what is this based on? Results first is based on a cost-benefit approach to government. And cost-benefit analysis is something that's been around a long time. It's the way that the private sector makes its investment choices. Because in the private sector, if you want to invest in something, the people who are giving you the money want to know, are you going to be able to pay me back? Kind of a neat concept. And we need to start thinking that way in government. And the nice thing is this is an approach which, while it has been very difficult to do in the past in government, to really rigorously assess what happens if we put money in this program? What would be the real returns for taxpayers? It's been a challenge to do that in the past, even though states are starting to experiment with it. It's much easier to do now, and we can do it in a very rigorous manner and give us some very good outcomes. And the goal of cost-benefit analysis is investment advice to help identify what options would achieve the outcomes we want to have and do so in a way that really gets us where we want to be. What gives us the best bang for the buck? And what this approach does is really give you investment advice. What's the best way of investing the public's money in a way to achieve the goals that we want to get to? Now, the good news is states are starting to experiment with this. We did a comprehensive report this summer that looked at how states are using cost-benefit analysis. And most of us heard about cost-benefit analysis in school. We hear about it from our private sector friends. But the question was, are states doing this at all? So we did a comprehensive assessment. We looked across the country for a 3-year period and looked at all the cost-benefit analysis reports that we could find across state government. And we really were looking at 3 questions. Are states doing this type of work? If they do this work, does it seem to make a difference? Do states pay attention to the results? So if we do an assessment of this policy choice, are states using that within the policy process? And what challenges do states face in doing cost-benefit analysis? So we did a comprehensive assessment. We surveyed a wide range of entities across states. We looked at state budget offices. We looked at legislative research offices. We looked at governor's offices. We looked at agencies, about 20 different agencies in every state, followed up by email surveys, followed up by telephone surveys. We really got a very comprehensive assessment of what are states doing in cost-benefit analysis. We identified about 1,000 studies that states said, well, we think that this was a cost-benefit analysis. We interviewed the researchers who did those. We interviewed state budget officials. We interviewed legislative budget staff. We interviewed agency secretaries and things like that to really get a comprehensive perspective of were states doing this and what happens when we did them. And we really looked at where states were on this, really looking at 3 primary things. How many studies had each state done? And what really explained that, the difference we found? Did these studies look at a single option or multiple options? Because one study that looks at a option can tell you whether this is a good idea or not, but it's more important to say, what are my other options? So if you tell me this thing that we're doing doesn't work, what else can I do? Because I still care about child welfare. I still care about K-12 education outcomes. So how broad were these studies? And then if a state did these studies, what happened? Was there a tangible outcome for the outcomes? And we classified states in each of these categories by really 3 boxes. States that were trailing behind, that they were done some of this, but not a lot. States that were in the middle, and states that were sort of clear leaders. And there were some clear leaders in these areas. Now, the good news is that all states had done at least some cost-benefit analysis. Some states did a lot more than others. Some states we only found 1 report that had been done during that period we looked at. Other states had pumped out 20 or 30 of these studies. Most states were sort of in the middle. They had done some, but not a lot of them. And 36 states indicated that they had used these results. So that we thought that was very encouraging, that while states had started to go down this path, this was information that policymakers paid attention to. And they paid attention to it in a couple of different ways. In some cases, it helped inform debate. But really, in a good number of issues, people said, yes, that report helped change the dynamic. It influenced a policy choice that we made to eliminate something or to change this program because it wasn't particularly effective. Or it influenced the legislature's decision to put more money into this because it was proven to be working. And one thing that we found was that the interest in this is growing with states. The number of states that are mandating cost-benefit analysis increased substantially over the period that we looked at. The number of studies we found produced each year changed dramatically from year to year. So I think that states are recognizing that this is an approach that is useful. But the challenge of these one-off reports, because that's what most of these are, is it only gives you a small piece of the puzzle. It tells me this reading program doesn't work particularly well, or that this transportation improvement really helped, or this one tax expenditure didn't really produce the outcomes we wanted to have. The challenge is, of course, you guys deal in portfolios. It's all the money that we're spending in criminal justice, all the money we're spending in child welfare, all the money we're spending in early education. What is the best way of achieving our policy goal? And the good news is we can go beyond what states are doing with these one-off studies, and we can start looking at these issues on a portfolio basis. And that's what Results First does. Results First is a way of giving you a toolbox that allows you to do these comprehensive assessments on a real-time basis. The first thing is, as I mentioned, we recognize collectively we have a lot of knowledge of what works. So the results first model is based on around 28,000 evaluations that have done across the country, and we've collapsed those research findings into categories of what we know by each individual program. For example, drug courts have been evaluated a lot of times using very rigorous evaluation studies with control groups. And the interesting thing is if you look at all those studies that have looked at drug courts in all these jurisdictions, a good study looking at a well-implemented drug court almost always finds about the same thing. A drug court will reduce recidivism by between 10 and 15% of people who go through them. Some courts are a little bit better, some are a little bit worse, but that's about how effective a drug court is. So if you do a drug court, that's probably what you're going to get because that's what we find is happening all over the place. Other programs have been evaluated across the country, and what this research shows is that those programs have about the same impact regardless of where you are implementing them if they are well implemented. What that allows us to do is to be able to predict what a program is likely to accomplish because that's what it does. Drug courts will have this type of impact. Cognitive behavioral therapy in prisons have about this level of impact. So we can predict, based on this research that's looked at a lot of programs across the country, what these programs are likely to accomplish. That gets us out of the box where we have, I don't know what this program is, I can send my legislative auditors to evaluate them, but they can only do about 6 of these studies a year, so it'll take me 40 years to go through everything my state does. We don't need to be in that box anymore because by sharing information about what we collectively know about what works, we know a lot about what works now. So results first identifies what we know about what works. The second thing is we recognize it's good to know that drug courts have been proven to be effective in Georgia. The first thing that comes to your mind is my state's not Georgia. And this is what a big challenge is. It's good to know drug courts can reduce recidivism by 15%. What would that mean in my state? If I am sitting here in Nevada, what would it mean if I did a drug court in Nevada based on my state's criminal justice population, the number of people who are in my state, the recidivism pattern of people in my state, the cost of serving people in my state? That's what I want to know, and that's what Results First does. It goes beyond the here's what a good program is. It says, here's what this program would accomplish in my state based on my unique characteristics. And the third thing we say is, here's what it would cost to do that program, and here's what those benefits would be in dollar terms for you. And this allows you to do a cost-benefit analysis and to do the same methodology using the same assumptions and the same approach for a lot of different programs across policy areas. This allows us for the first time to do an apples-to-apples comparison across policy choices. And that is a big advance in policy analysis because one of the challenges, as you guys know, in people coming up with you with studies is depending on what assumptions they put in a study, they can shade the results because, if they use a very generous, assumptions on impact, they can give you a result that fits their goals. So it's very important to do this type of analysis in a way that treats everything the same way, that really does the same methodology, same assumptions, same approach, and gives you an apples-to-apples comparison that you really can compare across programs and see what really gives you the best bang for the buck. So what does this look like in reality? The Results First process has several steps. The first is really looking at what are we doing now? What is in the base for this program? So for criminal justice, what criminal justice programs are we operating now? How much are we spending on each of these programs? Are they evidence-based or not? We have a list of evidence-based programs, and every state has a bunch of programs, and the question is, are these really proven programs? Or is this a homegrown program which they have no knowledge of whether it works or not? So the first thing we really ask is, what are we doing now? How much money are we spending on these programs? Providing that level of transparency to the process. And we'll also take a look at, is there reasonable assurance that these programs are being well implemented? A lot of these programs that are nationally proven have very specific tasks that have to be done in a certain way to have the impact we want to have. The same way that if you are doing heart surgery, there's a series of steps that you want the surgeon to do to make sure that the procedure is successful. A proven program has a series of steps that they want those programs to be done. For example, Nurse-Family Partnership is a program which serves low-income, first-time moms in high-poverty areas with the idea that a lot of these women, particularly they're teenagers, they really don't know how to be a mom. They don't have a support system. They don't have anybody to rely on. So they make terrible choices, and they end up with a huge problem, and a lot of those kids end up in foster care because the situation is not good in the home. Nurse-Family Partnership goes in and they provide, a registered nurse comes to that family during the prenatal period, and also usually for about a year or two afterwards to provide ongoing, basically, education for the mom. How do you prepare yourself for birth? How do you take care of yourself during the prenatal period? Then also after the baby is born, how do you take care of a newborn? What's the safe way of doing things? And also, they talk to the mom about how to get her life back on track. How do you get back into school? What are your career goals? How do I get back into becoming the person that they can be as a self-supporting individual? There's a series of key steps for this program that have to happen. Because if those program steps aren't done, the program will not be successful. So we'll look at, are these programs implemented in a way that are likely to lead to success? So the first step really is to identify what we know. Here's what we're doing now. And this is pretty much all the information that states typically get during the budget process. Here's what we're doing now. And then advocates will come and say, well, I've got 3 more programs I would like to get money for. So this is useful, but this doesn't really help you choose. So this is only the first step, is the inventory. The second step is to identify how much we spend on these programs. How much would it cost to do these programs on an individual basis? And we want to look at what the outcomes are on two levels. We want to look at what the taxpayer implications of a program are, how much money we spend on it, how much it costs to put people through Nurse-Family Partnership, how much it costs to put a kid into medical foster care homes, how much it costs to serve someone in a good preschool program. But we also want to look at the social impact of this as well, because public policy is complex. So we want to look at the societal costs and benefits of these programs as well. So take something like a criminal justice program. We don't care about crime only because we spend a lot of money on crime. We care about crime because we want to keep our citizens safe. So one of the things we'll look at when we're looking at criminal justice programs is not only what is the cost of crime for the system, and when we're thinking of cost, we want to look very broadly, because it's not just the cost of the prison bed for the state. It's all the costs that come into play when someone messes up. It's the cost of arresting someone. It's the cost to prosecute them, defend them, adjudicate them in the courts, house them in jails while that's taking place. Then if they're found guilty, how long they spend in prison, what type of programs they would receive. We want to look at all of those taxpayer costs because that's the fundamental cost of crime. We also want to look at the societal cost. What is the cost of crime? If these people have been out there committing 5 burglaries, how much did that cost society? And we can put a dollar value on crime. There's been a lot of research that's allowed us to identify what the cost of crime is. And it allows us to really look very comprehensively at what the policy implications of choices would be in terms of costs. So at the end of this step, we're able to say, here's what the cost of these programs are. And some programs have higher cost, some have lower cost. Actually, these are just the taxpayer cost of these programs. And some states have good accounting systems that bring this information to the budget process. A lot of them don't. And we'll see that some program choices are fairly expensive to the budget. Some of them are not. Putting someone in intensive supervision can cost up to about $4,000 in some states. Other programs, such as Scared Straight, much cheaper, only $65 to serve kids in that program. So if you got $2 million and you want to do something on crime, if this is the only thing that you do, what would you do? Well, a rational choice might be, let's put money in Scared Straight because I can buy a lot of slots in that program and I'll get a lot of bang for the buck. I can serve a lot of kids for $2 million for Scared Straight because it's only $65. The challenge is, if all you know about is the cost, that can get you in a place you don't really want to be, because cost does not buy you outcomes on an equal basis, because some things work and some things don't. So the third thing we want to do is to look at those outcomes of these programs and to put a dollar value on them. So for crime, we want to look at what the taxpayer benefits of reducing crime for a program would be, and what the victimization, the societal outcomes of a program would be. And to give you an idea what this looks like, this is based on Washington State data. This is the juvenile crime rate in Washington State for people who are seriously in the juvenile justice system. And traditionally what states have done for kids who are getting into trouble a lot, these are kids who have long rap sheets, is at a certain point we say, okay, we're done being nice with this kid. We're going to send them off, and we're going to send them to reform school. We're going to put them in a deep-end residential commitment bed, and we're going to serve a year or two in that deep-end residential commitment bed. We're going to provide them intensive services to help turn their life around. In the meantime, they won't be on the streets causing trouble. And hopefully at the end of that 2 years, when we've provided them intensive counseling services, we've gotten out of that bad environment, and we now have helped get them back up towards grade level in reading. Maybe when we let them out, then they will stay on the straight and narrow because we've taken them out and we've done something to them. There's a couple of challenges in doing that in states. One is it's really expensive to send kids off to a deep-end residential commitment bed. In most states, it costs anywhere between $60,000 and $120,000 a year per bed for these kids. So we spend a lot of money on them. The second problem is it doesn't work real well. This is the recidivism rate in Washington State for kids who have traditionally been served by deep-end residential commitment beds. And what you see is that after about a year, about half of the kids are back into trouble. They are back into the system. And if you go out a few more years, it gets over 60%. And if you go out about 6 years, about 75% of these kids are back in the criminal justice system. So yeah, we can take the kids and send them off to these deep-end residential commitment beds and get them out of the community for a couple of years and spend a lot of money, and we'll see most of these kids back in a couple of years. So we're spending a lot of money, not getting a great outcome. Okay, what else can we do? Functional family therapy is an alternative program that many states are now experimenting with. It's based on the idea that instead of sending these kids off and trying to turn them around, we'll keep them at home, we'll keep them in the community, we'll provide intensive services to them, but we're also going to provide intensive services to their family. Help deal with the family dysfunction that may be leading to the kid acting out, but also more importantly, if we can teach the parents to control their child, we don't have to do that for them as taxpayers. So it's a different approach. It's a community-based approach. It provides a market basket of services to both the family and the child, and this is being experimented with in a number of states. So the question is, does it work better than traditional sending kids off? Best research shows this program has been evaluated with very strong research designs in a lot of jurisdictions, is that it does have an effect on recidivism. It reduces recidivism for these kids by around 22%. So the bad news is a number of these kids will continue to go through this program, and a number of them will continue to mess up once they get out. The good news is it's 22% lower than it would have been if we hadn't done this. So instead of half the kids being in trouble within a year, it's about 25, 26%. You go out a couple of years, instead of 60% of the kids being back in trouble, it's more like 40%. So it is more effective than what we've been doing now. What cost-benefit analysis asks is, what's it cost to do this, and is it worth it to us? Is that 22% worth the investment? Is it a better investment for us, producing better outcomes at a lower cost than what we were doing otherwise? And fortunately, it is. This is based on Washington State data, who has looked at this program. It costs around $3,200 a year for each slot in this program, so that is much cheaper than sending the kid off. It's much cheaper largely because we're not putting them in a secure environment. They're staying in a supervised family setting where the family is providing food, clothing, shelter instead of us. So it is much cheaper. And also, this is what, on average, those benefits are. That 22% reduction in crime equates to about on average, $32,000 in benefits in Washington State. These are the taxpayer cost of not locking that kid up because they're getting into trouble in the future. It's also societal cost because it's 22% less crime that these kids are committing. There's 22% fewer people that they are robbing, assaulting, doing other bad things. So if you add up all of those benefits based on that research, it's about $32,000 in benefits. Because the kids are kept in the community, they are more likely to stay in high school. We don't disrupt their education. And because we know that kids who graduate from high school are more likely to become employed and to have better wage outcomes, that equates to about $6,000 in benefits per kid. Healthcare costs on average go down for a couple of reasons. These kids are not showing up in the ERs, they're not being brought in by the police because they're not getting into trouble as much, and also because these kids are more likely to graduate and get employed, they're more likely to have health insurance, so they don't come on to Medicaid. So on average, $300 in benefits there. So about $38,000 in benefits for every kid who goes to this program, or about 11-to-1 return on investment. And these are all discounted present values because some of these outcomes occur in the future. So we want to be able to say, if you put money into this program today, what are the benefits today for this program? So this looks like a good choice for Washington State, and Washington State has been investing heavily in this program because it has proven to be effective. It's proven to be producing a good benefit for outcome for taxpayers, and it looks like a good choice. If you think about this as sort of Consumer Reports, this would be a best buy for Washington State because it's effective, it's cheap, and it gives us where we want to be. We can do the same type of analysis using the same approach into other programs. So Nurse-Family Partnership I mentioned earlier. What's it accomplished for us? Well, in Washington State, it costs around $9,000 to put a first-time mom in this program. It's more expensive because we do it longer. This is usually for 2.5 years of services, so it's about $9,000. It produces a lot of decent benefits for the state, though. Reduced crime and abuse. The moms and their partners who go through this program are less likely to abuse their child. They know how to take care of the child because they've been having these services from a nurse that they know and respect. Also, the mom is less likely to get into trouble because they tend to stay in school more and to get their life in order. So there's less crime for the parents. When the child who goes to this program reaches teenage years, statistically they are less likely to get into crime themselves. So about $6,000 in benefits on that. You might ask, why is that so low? Well, that's so low because many of these outcomes are very long-term. We're doing this for the first 2 years of a child's life. We're talking about juvenile justice crime 10, 15 years out. So we're reducing those values by about 3% a year because we're doing this on a present value basis. Educational gains, big outcomes for us there. This is both for the mom because they're more likely to stay in school and to graduate rather than dropping out, as well as a child. Basically, the children who go through this program, because the moms pay more attention to them, they are much more likely to have good readiness scores when they get into school. So about $17,000 in educational gains. That is both for gains for the family as well as taxpayer gains. Reduced public assistance cost. Because the moms are more likely to become employed, those costs tend to come down about $6,000 per person. So about $30,000 in benefits in current dollars, or about a 3-to-1 return on investment in Washington State. So again, looks like a good deal for taxpayers. We're getting $3 for every dollar we would put into this program. Washington has been putting money into this program because it looks like a good bang for the buck. So we can do this type of analysis on a lot of different programs. And step 4 is really what I think is the cool part of this, is it allows us to do portfolio-based analysis on public programs. Being able to say, looking across the budget, what are our policy choices, all those choices that are before us, what do they cost, and what would we get out of it? And we see that some things which may have looked like a good deal when we only did part of this analysis, if all you heard about was Little Timmy stories and all you had was the list of programs, then basically it's, I will put money in things which we're already funding because people seem to like them, or that someone came forward with a really compelling Little Timmy story, so we'll put money into that. That probably isn't what we want to be doing. If all I pay attention to is cost, then, hey, I buy a lot of slots in Scared Straight because I can serve a lot of kids for my $2 million. Unfortunately, the research shows that Scared Straight is a highly effective program if you want to increase crime. Funny thing is that if what you do is you take a kid, and that's what Scared Straight does, is you get a kid who's been getting into trouble and you send them to prison for a day with the idea of we're going to scare them into staying on the straight and narrow. What it tends to do, and the research shows, it sort of demystifies jail and prison for kids. Because instead of there being this scary thing that sounds awful, I just spent a day and everybody seems to be doing okay. And surprisingly, they tend to get some hints from the folks that they talk to that are not just don't come here, it's, well, you know, if you're going to break into a car, here's the way you do it. And the research shows that kids who go through that school are not only more likely to commit crime than kids who don't, they're more likely to commit more serious crime than kids who don't. So Washington State would lose about $5,000 for every kid they put into that program. So on a return on investment basis, that $65, which sounded cheap, is actually very expensive. Would cost the state about $76 for every dollar they would put into it. And Washington State, not surprisingly, decided this is not something to do. So what this approach does is it does say there are things out there which research shows we're doing which don't work, and we should stop doing that. There's things which work okay, and there's things which are really best buys for us. So this is all based on Washington State data. Community job training and aid, basically when people are getting out of prison, linking them into community-based supports so that they have a good chance of getting a job and reconnecting to the community, so they will become good productive citizens, is really important. A good prison reentry program like that, Washington State's getting about $40 for every dollar they put into it. Hugely effective in helping people avoid future crime. Other things look okay. Mental health court, about $7 for every dollar you put into it, just not as effective in terms of a dollar-for-dollar basis as community job training. For kids, aggression replacement training, about a $40 return on investment for that. Teaching kids, if they don't know how to deal with frustrations of life, that there's things they can do other than beating people up, is pretty effective, and it is something which, for a dollar-for-dollar basis, is a good deal for Washington State. So Washington State's been doing this approach for about 15 years and has got some really good benefits. We'll talk about that in a minute. But they've been able to do this on an incremental basis and really drive their crime rate down substantially, but not only save a lot of money, but avoid a lot of cost because they haven't had to invest in things like building their way out of a prison situation. I'm going to turn it over to my colleague, Adrea, who will answer the question of, okay, what happened in Washington State and what's happening in the states that we're working in now to sort of give you an idea of where this takes us.
Thanks, Gary. Good morning. You had some great questions, which were actually covered in part of my presentation, so I'll be able to move forward a little quickly, and we'll be able to get to some interactive activities so you're not just sitting and bored, and then we can move on to some of the other policy discussions as well. So, long-term use in Washington State. We have a representative here from Washington State, and it's excellent when we're talking to our partner states to be able to point to the success that Gary spoke about earlier. So, about 15 years of implementing results-first approach in Washington State at the Institute of Public Policy, and it looks like they've lowered their crime rate and achieved $2.7 billion in the long-term benefits. If you look at the juvenile crime reduction benefits, and this is the first area that they examined using the results-first model, you can see that their incarceration rate is actually lower than the national average in terms of the reduction. So looking at the results-first work in our other states, because we all spend a lot of time talking about what's happened in Washington, but the results-first project is really looking at, can we take what they've done in Washington and apply that elsewhere? Will it work in other states? So I'm going to take a few moments to highlight what the work has been in other states and then talk to you about what it would look like to implement results first in your state. Currently, we are working in 15 jurisdictions across the country. You can see from the blue states that are highlighted that represents a mix of states, different sizes and geographic locations and political affiliations. California is highlighted because we've recently begun to work at the local level. So to accompany the recent public safety realignment initiative in California, we're working with their local jurisdictions to examine their programming and their funding decisions. We're beginning to see some interesting results in our states because they've all been working at for different time periods, but we've actually had some states complete their models and they're able to start to use the results in the policymaking and budgetary process. 8 states have currently implemented the adult criminal justice component of the model, and we expect several more to finish that by the end of this year. 3 states during the last legislative session enacted legislation that incorporates results first, the approach, into their policymaking and budgetary process. 2 states are using their models to analyze legislative proposals. They both happen to be in the area of criminal justice. And 5 states during this last session used their model to target or move $28 million in funding towards evidence-based programs. New Mexico is a great example. They're currently our star student of partner states, and the work there is housed in the Legislative Finance Committee, which is an excellent placement given their role in the budgetary process in the state. They began their results first work in criminal justice, as have all of our partner states to date, but they've, as Gary mentioned, expanded into all of the other policy areas. They actually issued a report, and I think someone touched on this earlier, if you're looking at the long-term cost of maintaining the status quo. So they looked at their currently incarcerated population and said, if we don't do anything right now, this population, given the recidivism trends over the next 15 years, will cost the state $360 million. So, I mean, that provides a good incentive to make some changes to your programming decisions and your funding allocations. And New Mexico has used their results first model to target $17 billion towards evidence-based programming in the areas of early education and criminal justice. They're working now, they've started to work more closely also with some of the relevant agencies to expand and enhance the results first process in the state, and they're continuing to refine some of the results and look deeper into certain policy areas. Iowa is another of our early states, and their results first model is housed in the Department of Corrections and has recently moved over to the Department of Human Rights, where the juvenile justice policy work is held. And they found that they were funding a domestic violence treatment program that was ineffective. So they've decided to take money from that program and invest in a new promising pilot program that is anticipated to have a higher return on investment. They're one of the 2 states, along with Illinois, that's also using the model to analyze proposed legislation. New York is an excellent example of a state that has taken this approach and made it theirs, and they're doing some pretty innovative things with it. The results first model was used to develop the governor's public safety budget this year, and he actually referenced it in his 2013 State of the State address. They've taken $11.4 million in the Alternatives to Incarceration grant funding, and they're restructuring that to prioritize evidence-based programming. $5 million of that has been designated for a competitive grant process. The applications will be assessed using cost-benefit analysis. And Mississippi is another example, like New Mexico, where the model is housed in the legislature. We have very high-level political support in the legislature. The appropriations chairs are actually leading the initiative. The work is being done by their Program Evaluation and Expenditure Review Committee, and we're expecting to have their first report on adult criminal justice programs this fall. They're also looking at juvenile justice and education programs in the state. And Vermont's an example of one of the states that we mentioned earlier that has codified the process, the results first process. So the work began in the Joint Fiscal Office, and they recently created the Criminal Justice Consensus Cost Benefit Working Group, which is a long title, but they're going to be taking on the results first work, and they've already made some decisions to use the model to shift programs to a program that was found to be duplicative. So they cut the funding to that and reinvested elsewhere. So as Gary mentioned, it can be, the results first model looks at several different policy areas, but the criminal justice, all of our states to date have begun their work in the criminal justice area. This is the most robust area of the model. It's where WISA began the initial development. And many of the other areas are actually linked back to crime avoidance and crime outcomes. So, after all the talking that we've done to you this morning, I'm sure you're wondering, those of you that aren't results first states, what it takes to become a results first partner state. So I'll just go over that really quickly, and then we have some questions that we can hand out to you so you can kind of think through the structure of implementing results first in your state. And coming into a state, we have 3 basic criteria that we like to examine to assess a state's likelihood of implementing results first with success. Let's see. So we require a commitment to evidence-based decision-making at the leadership level. So we don't say that you have to use the results or issue a report necessarily, but we do ask that the leadership in the state is committed to examining the results and making decisions based on evidence instead of politics as usual. The ability to provide the data is important. We have technical assistance providers that work with the states to get the data in the format that it needs to be to enter into the model. It's also important for the individuals that are working to populate the model to have access to that data. And then there's the willingness to dedicate the resources, which is primarily the staff time necessary to dedicate to populating the model. In coming into a state, we require letters of invitation from the governor and legislative leadership. This is important for a couple of reasons. One being that it helps to ensure the longevity and sustainability of the results-first approach, and then also that increases the likelihood that the results will be used in the policymaking and budgetary process. It's also important to have that interbranch buy-in early on, because it's easy to say, well, this is your initiative, I'm not sure I trust the results, but if you're bought in all along, then there's ownership of the initiative. It also prevents it from being as political and becomes more of the regular process as revenue forecasting would be, for example, in terms of developing the budget. Something that we talked about earlier that you touched on was having the data validity and making sure that everyone was comfortable with the data. So we ask that you appoint a policy work group that's going to bring together the leadership from the agencies and the entities that are involved in the process, and also a technical work group. So that way, as you're working to collect the data and verify the data and validate the data, all of the parties for whom the data will be collected and analyzed are able to work through the process, and they can verify, they can verify that the data that's included they're comfortable with. And actually the last bullet, I think, is also a benefit instead of just a role of the partner states, because as becoming a results-first partner state, you really enter into a community of practice. So you're able to work with the other states who are doing this innovative work and troubleshoot problems and ask for their advice and share innovative practices. As Gary mentioned earlier, we provide the software and our technical assistance free of charge. And our technical assistance providers work very intensively with the states on the ground to get the model up and running. And also we work to make sure that the results are communicated efficiently to the policymakers. I think it's important to note here that Results First is a capacity building initiative. So we want this process to become part of your approach. This is your model, and this becomes your Results First initiative in the state and is intended to be a longer term initiative. I'm sure you're all familiar with programs or projects that will come in and collect your data and analyze it and issue a report and maybe stir things up a little bit and then leave. But that's not the Results First approach. So it really is working with you to take this and make it yours. So we have some questions since we've done a lot of talking at you this morning, and we'll give you those questions to kind of think through some of the items that we discuss with states when they approach us about becoming a results first state. So we'll give you a few minutes to think about some of those, and then we'll open it back up to discussion, and then we will have a short break before moving on to the next section.
And these questions really deal with what would results first look like in your state if your state decided to move forward. One of the key questions is who would do this in your state? And this is a good amount of work that needs to happen. And what our experience has shown, it needs to be a group that first and foremost is an honest broker that you trust. And whether that's the governor's budget office, a legislative budget office, or a work group that's both of them, it really has to be a group that has technical skills necessary to do the work. but also has to have that honest broker status and also needs to have access to the policymaking process. Some states initially started with the bureaucracy, and the problem was they issued a report, but it had to go through 15 layers before it got to the legislature and governor. That's pretty suboptimal for this because it needs to be something that really has that honest broker status that really is part of the process now. So. Okay, folks, the purpose of this was really was to get you to start thinking about this. What we do with states, if states are interested, the next step would be after we hear from you and say, yes, we're interested, we would come to your state and workshop this and hold meetings with legislative folks and governor's office folks, because this is something that we really want to get a perspective from on your end in terms of what this would look like moving forward. What we have learned in working with the states is it is important to get this right at the beginning. So we want to have a series of discussions to sort of see what would work on your end. This isn't something where you can take the approach from Iowa and apply it to Nebraska, or you can take what New Mexico has done and just drop that into New Mexico. New Mexico and drop it into Arizona or something like that. It basically has to be something that fits in your state based on your state's organizational structure, political culture, and all of that. So the issues of who would do this, who is the honest broker that would fit in your state is an important one. Getting an idea of data availability and implementation plan to give everybody a realistic expectation of how long this would take, what it would look like, is something that is there. The exciting thing about this, I think, is it's allowing us to do on the spending side what we've been increasingly been able to do on the revenue side for the last 20 years. If you go back in time, not that long ago, when states were faced with the issue of how much money do we have to put into this appropriation cycle, states did very primitive estimating. Basically, it's like, well, it went up 3% last year, so we're going to say 3% more money this year. And not surprisingly, those estimates particularly weren't good in a lot of cases, and states found really nasty surprises of, oh, you said I had 3% more money, and now I'm 6 months into the year, and I'm 5% down. Or, hey, I've got twice as much money coming in as you told me, so what can we do? So states started building econometric models, and now no state would really think about going into a budget cycle without doing an econometric analysis to say, based on our state's economy, the regional economy, the national economy, the world situation, here's how much money we think that we would have. And states are increasingly using those models to estimate things like, if we change our tax code, what would happen? We can start doing that now on the spending side. We have the research base to be able to predict impacts in a lot of areas. So it's like this old $6 million man, we have the technology. The question is, how can we build this approach in the future? We can't do this in all policy areas, but there are a lot of folks out there who are doing this research review. Our goal and results first is to build this model as fast and as proactively as we can. We're looking for input from state partners on this. What other areas that aren't in the model now should be in the model? We know that healthcare is a big issue, so we're giving that priority to building the model out. And we know that other states have programs which are producing great results. We want to identify those, put them in the model so that we can give states the widest range of investment advice that we can.